Statins are strong medicines that are used to treat high cholesterol, and they have serious side effects. But the thing is that not everyone with high cholesterol actually needs to take them. If your doctor is pushing you to take statins, I'm going to give you 4 questions you need to ask your doctor that will help you decide if it's worth it for you to take them or not. Before we get into that, if you're struggling with your blood sugar, I have a free document that will guide you on the best foods to eat to lower your blood sugar and the ones to avoid. And you can get that from the link in the description. If we want to talk about statins, we need to talk about cholesterol. Cholesterol is a fatty, waxy substance that your body makes in your liver, and it has so many important functions. We need it to make hormones like estrogen and testosterone. We need it to absorb fat-soluble vitamins, to make vitamin D for a strong immunity to fight disease. Without cholesterol, we would die. 80% of the cholesterol in your blood is made by your liver. The rest comes from your diet. Statins act by stopping your liver from making cholesterol. So when you do your blood cholesterol test, you'll get back numbers for HDL, that's the good cholesterol in quotes, LDL cholesterol, the so-called bad cholesterol, and triglycerides. When your blood test shows that your LDL cholesterol, that's the so-called bad cholesterol, is high, then your doctor will most likely insist that you start taking a statin. This is because of the belief that having high levels of this type of cholesterol, that's the LDL cholesterol in your blood, will make it more likely that you have a heart attack or a stroke. So statins are like the knight in shining armor who's going to ride in on his white horse and rescue you from certain death. If you've had a heart attack or a stroke before, then your doctor could begin to make an argument for starting statins. I'm not saying you definitely have to take them in this situation, but at least you might want to have that conversation, especially if you haven't done anything to change your lifestyle. So we've talked about cholesterol. Now let's get to the questions that your doctor should be able to answer for you. I have to warn you, most doctors will get upset when you start asking a lot of questions. And to be really, really honest with you, I used to be one of those doctors. So the first question is about risk factors. If you haven't had a heart attack or a stroke, then you would ask your doctor, what risk factors do I have for heart disease or stroke? Having insulin resistance with or without high blood sugar is one of the biggest risks. So let's just take a minute and talk about blood sugar. When you eat your potatoes or rice, they're broken down into sugar. How is that possible? Well, these foods contain starch, and starch is made up of long chains of glucose glued together like pearls on a string. These long chains are chopped up to release the single glucose molecules which go into your blood. So this glucose is what we measure in your blood when we say that you have high blood sugar, or more accurately, we say you have high blood glucose. When your blood glucose, that's your blood sugar, rises above a certain level, your pancreas in your tummy releases a hormone called insulin. Your body uses hormones to send messages around your body. So insulin travels to every part of your body through your blood, and it goes around knocking on doors, telling each of your cells, look, this is dangerous. There's too much glucose in the blood. I need you to open up and take some so the levels in the blood can come down. If you're healthy and everything's normal, when insulin knocks, your cells listen and they open up and take some of that glucose out of your blood and into the cells, and your blood sugar comes down. Unfortunately, as we keep on eating and eating, and as we're getting fatter over time, these cells become stuffed and uncomfortable. You know, the feeling you have when you've had so much to eat that just looking at food makes you feel like throwing up. Just like that. So now, when you eat, your blood glucose goes up. Insulin comes along and knocks on the doors, telling your cells to open up and remove some of that sugar, that glucose, from your blood. And the cells, they're like, no, no, thank you. We're stuffed. We can't take any more. And they refuse to open their doors. And the sugar in your blood stays high. So this is where we talk about insulin resistance, which is really, really important when you're looking at your risk for having a heart attack or a stroke. If insulin knocks, talks to your cells, and they listen and open up, that means that your cells are responding to insulin. They are sensitive to insulin. But if insulin knocks and the cells don't listen and they don't open up, that means that they've become stubborn. They've become resistant to insulin. If your cells aren't removing this glucose, this sugar from your blood, what happens? It goes around your body and attaches to everything. So you might have blindness. It affects your heart, your kidneys, your sexual function, and so much more. Now, when your pancreas sees that your blood sugar is still high, what does it do? It becomes hyperactive. It produces and releases more insulin so it can overwhelm these cells and force them to open up and remove that sugar from your blood. This way, your blood sugar comes back down to normal. Now, this works for a while, but then the cells are so uncomfortable that they become stubborn again. And your pancreas produces even more insulin. Then your cells become stubborn, and this game goes on and on and on until your pancreas just can't produce enough insulin to force the cells to remove the sugar from your blood. And that's when your blood sugar finally starts to go up. People tend to concentrate on high blood sugar, but this resistance to insulin itself has its own set of problems, even if your blood sugar is normal. So you may have high triglycerides, which are a type of fat that I mentioned before, which increase your heart attack risk and cause problems for your pancreas. You might have high blood pressure. You might have high uric acid levels, which can cause swelling and pain in your joints. You may have erectile dysfunction, increased risk of getting different types of cancer, and weight gain. If we're talking about insulin resistance increasing your risk of having a heart attack or stroke, there are tests that can tell you more about how your body is responding to insulin. First of all, the HbA1c test. This gives the average of your blood sugar over the last 3 months. And if you remember, when you have a lot of sugar in your blood, that implies that you are insulin resistant, unless you have type 1 diabetes, which is a different story altogether. Another test is the HOMA-IR test, which tests for insulin resistance directly. And still talking about insulin resistance, do you have other problems like high blood pressure? What is your waist circumference, your waist measurement? Do you have a lot of fat around your belly? And are there members of your close family, like your parents or brothers or sisters, who have heart disease or have had a stroke, which might suggest that your chances of having that are higher as well? Next, if we look at your blood cholesterol test, which measures different types of fats in your blood, Are your triglycerides low? Is your HDL cholesterol, that's the good cholesterol, high? If the answer to both those questions is yes, then your risk is much lower. So the first question you asked is all about risk factors. Do you have signs of insulin resistance, or have you done any tests that suggest you have insulin resistance? Have members of your family, your close family, had a stroke or heart disease? So on to the next question. If you have high LDL, that's a bad cholesterol, your doctor may assume that you have damage to your blood vessels, which can lead to a heart attack. So the next question you might want to ask is, can I do a CAC score test? This is a CT scan that measures the amount of calcium in the walls of the arteries of the heart. The more damaged these arteries are, the more calcium you'll find in the walls of these arteries, and the higher your risk of having a heart attack or stroke. If you have a very low CAC score, then your risk is very low. Depending on where you live and what type of health insurance you have, you might be able to get this done free. Otherwise, you'd have to pay for it. But the expense would be worth it if it means that you can avoid taking medicine that you don't need. Next, you should ask, what are the actual benefits of taking statins for someone like me, for someone that's my age, my sex? Let's say you're a 60-year-old female. Okay, so what are the benefits? How much would taking a statin reduce my risk of having a heart attack or stroke? Would it reduce my risk by 10%, by 50%? And then, in terms of benefits, how many extra years of life would someone in my situation expect to get from taking a statin? How much longer would I expect to live? And then the third question regarding the benefits is that what side effects might I experience from taking statins? All the studies that have been done to show how useful statins can be, they're a bit confusing, and a lot of the early studies were done by drug companies themselves, so you don't really expect them to be fully transparent. There's a website, a very useful website. It's totally free. I'm not being paid to recommend it. Everybody knows about this website. That kind of helps to decode everything about taking statins and other medicines for that matter, and makes it easy for anyone to understand the benefits and the risks. The website is called thennt.com. I'll put it on the screen. NNT stands for numbers needed to treat. It asks, how many people do you need to treat with a particular medicine for one person to benefit from it? So for statins, in people who already have heart disease, you need to treat 83 people with statins to save one life. You need to treat 125 people with statins to stop one person from having a stroke. In people with a low risk of having disease of the heart and blood vessels, you need to treat 217 people with statins to prevent one heart attack, and you need to treat 313 people with statins to stop one person from having a stroke. Judging from the way people try to make out that statins are the best thing since sliced bread, these numbers they're not like, wow, they're not looking particularly impressive. And people are missing the plot here. We're so fixated on treating numbers because that's where the big money is. After all, why are you taking the statins? To have a longer, healthier life, right? And if it's not delivering on that promise to most of the people that are taking it, then really, what's the point? And then you need to remember that statins have serious side effects. So it's not only that you're not doing much good to most of the people that are taking them, you're actually causing some of them harm. Statins increase your risk of getting type 2 diabetes. And guess what? diabetes actually increases your risk of having a stroke or a heart attack. So you're causing the problem that you're trying to run away from by taking statins in the first place. and then there's the excruciating muscle pain that some people have when they take statins. I remember one patient who refused to stop taking his statins, even though he was having terrible, excruciating pain in his thighs, because his doctor had basically convinced him that he would have a heart attack if he stopped. The next question you should ask is, assuming I do need to lower my LDL, bad cholesterol, are there any natural ways to do this? How can I improve my health without taking medicine? If you have insulin resistance, prediabetes, full-blown type 2 diabetes, you shouldn't be wasting your time focusing on lowering your LDL cholesterol while ignoring the major problem that is definitely going to increase your risk of having a heart attack or a stroke. Just like the ancient Roman Emperor Nero, you'd basically be fiddling while Rome burns. If you're worried about having a stroke or a heart attack, the best thing you can do is to reverse your insulin resistance and lower your blood sugar. And I'll show you step by step how to do that in this next video.